these aren't normal times that we're living in. What started off as, a story here, a story there, actually started becoming and emerging like a broader issue that everybody was talking about in the community as a whole. Before such observations were being made by mainstream media, our team and the immigrant community advisors we work with were saying that mental health support was quickly becoming the #1 health need in our communities. In particular, there was talk of the utter lack of services and social norms needed to cope, and that more and more people were turning to drugs and other forms of self-medication to manage the distress that they were experiencing. One staff in particular described addiction and overdose rates during the pandemic as the secondary pandemic. Overdose rates are at record levels and were in fact the #1 cause of death among young adults in Minnesota in 2021. We started in 2021 by designing a holistic mental health strategy using a multi-pronged approach that first and foremost sought to reduce stigma, increase conversation, ease and knowledge, and reduce stigma overall. It also is designed to promote access to care and then also to directly provide culturally tailored resources and education. We invested significantly in staff skill building and began a general mental health education campaign. We believe that the WellShare community health worker approach is in fact the approach that's needed to address these times and these particular challenges.
What breaks my heart is seeing little kids that I used to see in the elevators and in the community like Brian Coyle Center, those children now potentially going through these illnesses and their life is overtaken by this.
As a result of the many traumas and stressors that are faced by immigrants and refugees during their physical and psychological journey, they have been found to be at high risk for mental health problems more than the general population. And substance use disorders and mental health diagnoses are very closely connected, and they're very often co-occurring. Drug overdose deaths, like Michelle mentioned earlier, increased by 30% in 2020. Overdose deaths were higher in areas with greater income and inequity. There is a huge stigma attached with mental health and substance use disorders in most cultures, where patients are extremely unwilling to attribute symptoms to a mental disorder.
Many of the communities we serve come from communities where they are essentially locked away in their own families, literally chained in the yard of the family 24 hours a day. So nobody wants to be associated with something that cannot be treated, which fuels the stigma. We meet community members where they are at and provide a safe space to share their experiences and identify personal barriers to well-being. We have been invited by Governor Wells to share our solutions and partner with his administration to better reach immigrant and refugee communities in Minnesota.
People expect individuals with mental illness to advocate for themselves as if their illness is non-existent. You don't feel the effects of fire when you're in the fire, you feel it afterwards. You don't feel the effects of the trauma until you get to a safe harbor like the United States.
About 50% of our staff are now trained in mental health first aid and mindfulness-based stress reduction techniques to help reduce the stress and chronic stress, to regulate the emotions, and to be able to identify mental health issues and substance use disorders.
Support is very limited in the Somali community, and there are so many barriers to get care. Because I built a good relationship with the client, he trusted me with taking his symptoms seriously and find an intervention that will help him. Now, more and more younger generations are able to identify mental health and substance abuse issues and have the courage to ask for help.
There is a lot of work that needs to be done in our communities regarding raising awareness about mental health and making sure the connections between substance use and mental health are there.
Our gift not only helps people address mental health issues, in general, but it is a really important opportunity to help break cycles of intergenerational trauma for the generations to come.